I want to welcome you all to a class that I believe will make a huge difference in enjoyment of your life and your family's life. I want to talk to you about how to stay young for the first 100 years. Now, I know what some of you are thinking. You're thinking the title sounds catchy, but do I really need to know how to stay young for 100 years? This sounds pretty far-fetched, but it's really not. You need to start thinking about what it means to live a long life. In the let's look at the facts. In the 1900s, the average lifespan was 49. And there's no question that this was because many people were dying at such a young age. They didn't have the kind of cures, the kind of health care that we are provided with today. But that's the point. Everybody's chances of living a long, healthy life were much less back then. As a matter of fact, the average lifespan today is 77 and a half and growing. A recent study, scientists from the University of Texas reported on the Today Show that by the year of 2050, Americans will be living over 100 to 150. So what does that mean? That means that your family needs to start thinking about what it means to stay young. Yes, this is a topic for you and your family need to know. If we're going to live for 100 years, we need to live that long life to be a quality long life. We don't merely want to just exist on this planet. We want to be able to live, to play, and to work on this planet. We want a quality life. Now we have a huge group of baby boomers getting older, and we can see in large numbers the effects of long life can be. Long life reveals that there are many health concerns that we are now much more aware of. These areas have never been seen before because we haven't had such a large group of people growing over the ripe old age. For example, we now are continually being confronted with the devastation of mental diseases such as Alzheimer's. It didn't just start. Alzheimer's has been around for a while, but we're just now seeing it more because dementia doesn't usually come on a person until the age of 70 or older. Now we realize the chances are much greater that we will reach this age. We need to take some precaution to make sure that we can still use our minds when we get this age. We also see more importance of taking care of our skin. Old age has brought huge growth of cosmetic surgery. More and more people are trying to correct the wrinkle problem that come with old age. But the biggest problem that we can see is the increased lifespan of our musculoskeletal problems. In other words, your mobility functions, the ability to move like we used to. We have increased the odds of living past 80, and we've increased the life's activities, but we have not increased the change that we have not changed the way we take care of our spines. We are the first generation to witness the ramifications of that long life creates. It reveals areas of neglect. Now let's state the facts. The most common cause of functional disability in a person over 50 is spinal disorders. Wow, that's really important to know. How many of you are going to live past 50? How many of you think your family is going to live past 50? All right, let's think about this as an example. Oh, I'm going to change this. Yeah, okay. If I knew who was going to rob your house and what time they were going to do it, and I told you about it, would you do something about it? She needs to do the other table too.
Okay.
Would you do something about it, or would you just let it happen? Now, what if I could tell you who was going to rob your mental capabilities and when it was going to happen? Are you going to do something about it, or are you just going to let it happen? Of course not. Let's prevent it. Just like we would prevent someone from breaking into your house. But I think we can all agree that we should work harder to prevent our health from being stolen and our ability to function when we would our possessions from being stolen. Think about this. If we lose our mobility at 65 and we live to 105, that is 40 years of immobility and pain. Let's take a look at some areas of healthcare where we have already made some adjustments and improvements of our health. Look at the advancements that we've made in tooth decay. We used to have many more cavities and less teeth in years past than we do now. If you want to pause it, I'll just